Hey, what's up guys? So yesterday NEET PG 2020 exam has been concluded. So here are some NEET PG radiology recall questions that I collected from various groups and from various students, and I'm posting the answers to the best of their memory and my memory. So let's get started. So first question, 6-year-old child with UTI, what is the likely diagnosis? And they have given an image here. So guys, this is an image of MCUG showing that there is reflux into bilateral ureter and into the kidneys, and therefore there is calcitasis also in the kidneys. So this is a case of vesicoureteric reflux grade 5 VUR. So this is the answer for this question. Urinary bladder diverticulum, many people have this confusion. So it will look like, so this is the bladder and it will have a outpouch. So bladder outpouch, but here the case is a VUR and this is a vesicoureteric reflux. So next question. Okay, so next image, a delayed IVP image was given and the diagnosis was being asked. So there are multiple options here, but I think the option which clearly depicts the question is, so guys, if this was the image that was given, then the answer would be pelvic ureteric junction obstruction. So it is gross hydronephrosis due to PUJ obstruction in the kidney. Staghorn calculus would look something like this, a radiopaque density which is extending into all the other calyces. So this is how a Staghorn calculus would look. Renal cyst will not take up any contrast, so that is out of the question. Putty kidney will be a small kidney in tuberculosis which will show calcification of the cortex, so that is not shown here. So this is likely a PUJ obstruction. So next, HSC image of 25-year-old female given and they mentioned infertility in the question. So guys, whenever something like this is given, just look at this angle. So this angle here is very less, 10 to 20 degrees. 10 to 20 degrees. So this would be a septate uterus. It's not bicornate because bicornate will usually have a broader angle. Okay. So the answer is septate uterus. Next up, 30-year-old male with RTA, blooded external meatus. RGU image given, most likely site of urethral injury. So guys, remember this is how urethra will look. This is your bladder. So this is the posterior urethra. This is the anterior urethra. So this is the penile urethra. This is the bulbal urethra. This is the membranous urethra. So based on where the site of extravasation is there, that is the site of rupture. So most of the people are telling that the extravasation was at this site, extravasation was at this site. So it would make membranous urethra the answer. So acute onset right limb pain, there image was given was a Doppler. This is a color Doppler image and this is spectral Doppler. This is spectral Doppler showing biphasic waveforms. This is a color Doppler image. So the answer is ultrasound Doppler. Next up, this image was given. So this image was given. This is a pretty straightforward image. Most of us may have seen this image already. So this is a PET CT image, which shows both the anatomical and functional activity of the body. Anatomical activity based on the CT and functional activity based on the uptake of radioactive tracer in various parts of the body. So here you see the tracer is predominantly in the brain because brain predominantly depends on glucose energy. Next up, child with recurrent abdominal pain, straightforward. This is the claw sign which you see. So this was given and the answer would be intussusception. So in volvulus you will have a large coffee bean sign. In atresia you will have double bubble sign. In malrotation there will be only opacification of bowel loops of one side in the abdomen. So the answer here is intussusception. Next up, 30-year-old male patient with RTA, BP is dropping, respiratory rate is high, chest X-ray given. Chest X-ray was showing, see there are no lung markings in this side of the chest. So this is a pneumothorax and there is mediastinal shift to the opposite side. So this is a tension pneumothorax and the treatment of choice or the next step would be chest tube placement. Next question, 45-year-old female with recurrent swelling on one side of the mouth. Diagnosis. So the image given was something similar to this. It was a cyelogram Therefore, the answer would be sialolithiasis, that is stone in the salivary glands or in the tract of the salivary drainage. So, the answer is sialolithiasis. Next up, 35-year-old alcoholic male, X-ray was given, effective way to treat. So, the X-ray clearly shows air under diaphragm. So, the answer would be laparotomy. So, next up, rupture of sacral aneurysm leads to. So, remember guys, all the major blood vessels so remember guys, all the major arteries in the brains are floating in the arachnoid space. All the major arteries in the brain are floating in the arachnoid space. Therefore, then whenever there is any rupture of any of the artery or any of the aneurysm of those arteries ruptures, it will lead to subarachnoid hemorrhage. So, that is the answer in this case. Next up, 25-year-old patient with fever, dry cough, breathlessness, night sweats. Chest X-ray shows symmetric bilateral IR lymphadenopathy. Since it is actually all the clinical history here points towards tuberculosis, but they have mentioned symmetric bilateral IR lymphadenopathy or bilateral IR lymphadenopathy. So, that is something very specific to sarcoid, and that is what I think the answer is in this case. So, I would go with sarcoid because they have mentioned bilateral lymphadenopathy. Next up, 65-year-old male hypertensive with sudden onset SOB. So, male hypertensive sudden onset SOB. So, they are talking about pulmonary edema. So, you have this bat-wing appearance of edema here in this patient. So, the answer would be furosemide. Since that is not there, the answer would be nitroglycerin. Next up, 65-year-old male with fever and expectoration. So, fever, expectoration, they are expecting something like pneumonia. So, without even seeing this, mediastinal mass is out of the question. Diaphragmatic hernia is out of the question. Pleural effusion is plus or minus out or not out of the question. So, next up we see the image. You see clearly there is consolidation, and this dark one is the bronchus. So, this is the air in bronchus consolidation. So, next up something like this was given in the exam and they were asking about the answer. So, you can see all the bones are weirdly bent and there is osteopenia also. So, this is most likely osteogenesis imperfecta. So, if that was in the option, then that would make that the right answer. So, that's it about this radiology recall questions, and thank you for watching.